Happy Thursday. My name is Dennis Walcott, and I have the honor of being the president and CEO of the Queens Public Library. And we welcome you to our virtual interview with two fantastic people who are on the front lines, making sure that they're both serving the public in so many different ways. And I want to thank them and their teams for one agreeing to do this and helping us set this up. This is about the issue of race and racism, and these are two very accomplished individuals. And before I introduce them to all of you, I want to take a moment to reinforce a very important point, and that's around Census 2020. And please complete your census forms. In New York City so far, only 55.5% of households have responded. And no matter your background, your immigrant status, your housing status, it's crucial for you to fill it out. It takes only 10 minutes. I did mine when it first started, and it was so fast. And I know that the two individuals we're about to talk to have done theirs as well. And you'll probably hear from them about that as well. But since drives funding to the residents of New York City, to hospitals, to schools, to institutions, you name it, census is extremely important, and we should not allow people to try to prevent us from filling out those forms and putting up barriers there. So with that being said, let me take a moment to introduce the two individuals who agreed to participate today. First is Attorney General Letitia James, or Attorney General James. She is the 67th Attorney General for the state of New York, the first woman, the first Black woman to serve in that capacity. She came to this position in 2019 with a long, distinguished, proven track record, really advocating for the most vulnerable among us, successfully addressing issues such as gender wage gap, tenant protection, children in foster care, issues involving police, issues involving, which we'll talk about, the NRA. And prior to her election as Attorney General, she was the public advocate for the city of New York. And before that, she served 10 years as the New York City Council member representing Fort Greene, Clinton Hill, Prospect Heights, and parts of Heights and Bed-Stuy in Brooklyn. She began her career, and I didn't know this beforehand, as a public defender in the Legal Aid Society. And she is a proud Brooklynite. She is a graduate of Lehman College and Howard University School of Law. And I got to tell a quick personal story about the Attorney General. There are a number of times we've interacted with each other. But one time I remember was after you were first elected Attorney General in 2004. And I remember coming to your office in Brooklyn and talking to you. I think I was deputy mayor at that particular time. And just your passion, your commitment to the community just jumped off the page. And I've always been impressed from that time. And then the other personal story I want to hear is you coming out to Laurel, Queens, and marching in the Memorial Day Parade, and always being there and interacting with people. And always amazed at the different houses that were owned by Blacks in the community. And I always wanted to say thank you for just coming out and being always a part of the community. In addition to Attorney General James, we have Dr. Wayne Riley joining us. Wayne was appointed in 2017 as president of SUNY Downstate Health Sciences University, the only academic medical center in Brooklyn. It was one of the 3 COVID-only hospitals from March until June, the height of the pandemic in New York City. Prior to coming into Downstate, he was a medical and health policy professor at Vanderbilt University School of Medicine. And before that, Dr. Riley was the president and CEO of Meharry Medical College in Nashville. We all know about Meharry. Born in New Orleans, Dr. Riley is a graduate of Yale and, hold on for a second, and Morehouse School of Medicine. You're going to find a theme in a couple of seconds here. And holds a master's of public health and a master's of business administration. He currently lives also in Brooklyn. He is on the boards of the Bed-Stuy Restoration Corporation. And I think when we probably last saw each other in person at the YMCA of Greater New York. And one story about Dr. Riley, while we really don't know each other that well, I found out there's an interconnection there. In that when he was 26 Attorney General, 26 years old, Dutch L'Oreal appointed him as deputy mayor for the city of New Orleans. And he stayed in that position, I think, for 5 years. And I'll tell you about how it's such a small world. So early this morning in my crazy hours when I'm watching television, who do I see on television? The state of Black America for the National Urban League, but
That's right.
Oriel and Dutch's son. And so that interconnection is just so important as far as these issues are concerned, talking about race. So welcome to both of you, and thank you again for joining us. Attorney General, if you would just share a little more about your background and talk about the issue of race and how you viewed it, but also before you do that, I got to ask you, I have to say, something happened yesterday where it also involved a Howard graduate and involved, I think, a former attorney general. I would be remiss if I didn't ask you to give your comments about that.
Well, first, good evening, and thank you, Dennis, for that kind introduction. And it's an honor and a privilege to join Dr. Riley in this important and timely conversation about race and equity and justice in our country. Yesterday was a historic day. The nomination of Senator Kamala Harris out of California, who was the first African-American attorney general, Black attorney general in this country. She is the one that broke through glass ceilings. I am the second, but we are both proud graduates of Howard University. And she's ready to take on the mantle. She has served as when she served as the attorney general, she took on banks, she took on big oil, she took on landlords, and she obviously has foreign experience, and she's prepared to serve as vice president as well as serve as president day one. And so it truly is an honor, and I can't wait until the debates. I'm going to have popcorn. I'm inviting people over. And so if you're not doing anything, come on over, Dr. Riley. I know you live in Brooklyn. It's going to.
What, Queens is not allowed? Excuse me? Queens is not allowed?
I'm into Walcott as well.
I'm sorry. I didn't know there was a border war going on where Queens was not allowed.
No, you can come on over. It's going to be a good time. And listen, democracy is on the ballot.
That's right.
And we've got 82 days, but who's counting? Until we can restore the exceptionalism of the United States of America, but where we can have a very humble and compassionate president of the United States, as well as a vice president who will restore honor and dignity to our country, and individuals who understand the rule of law and the respect for all individuals, and recognize that we should not be divided. We're more divided now than we've ever been, I believe, since the Civil War. And we have more in common than not, and we really should be united in our values and in who we are as Americans. And so congratulations to Senator Harris. It's a great day. But right now, unfortunately, in our country, we are dealing with two crises. One, crises that basically underscore the disparities in enforcement and treatment by communities of color. We are basically seeing this public health crisis brought on by COVID-19 pandemic, which is having a disproportionate impact on Black and Latino people. And the second is related to how the communities are policed and the continued tense relationship with communities of color in our nation. The pain is deep and the divide is real. We need to look no further than the recent peaceful protests that erupted across the nation. And in fact, they're still protesting. I live blocks from the Barclays Arena, which has become the main station, the town center, the town square, where individuals are protesting this evening against police brutality in the wake of the murder of George Floyd. And we know that these protests are more than just about police inequality. It was fueled by the inequities in the economic system, inequities in the healthcare system, inequities in policing, and the inequities go on and on and on. And they laid bare before the nation. And we're seeing the fault lines of race and the social imbalances in our nation. And these inequities are not simply inconvenient truths. They are, in fact, deadly truths, and they need to be confronted, and we need to talk about them. In the immortal words of the late Congressmember John Lewis, an American hero who understood the heart and soul of this nation better than anyone, when you see something that is not right, not just not fair. You have a moral obligation to say something, to do something. I was on a panel 2 days ago at a church in Brownsville where a doctor from your hospital came and was on the panel, and he talked about how he wears his scrubs every day. I believe his story was in the Washington Post. And he was the panelist, and it wasn't surprising to any of us, but was very hurtful, because during the era of stop and frisk, where I battled, the previous administration, I talked about my minister being stopped, my nephew, my brothers, my neighbors. I talked about my nephew, who describes me as his favorite aunt, even though I know he lies because he's got several aunts. But he came to see me one day from college, and he was stopped not too far from my house. And I remember him coming into the house and crawling up in the corner and saying, "Auntie, I did nothing wrong." And he cried. And to see my nephew, who I consider like my son, cry, that hurt me to my core. And that's why I had to be a part of that litigation. I had to challenge the system, and I had to speak truth to power. And that is why tackling this crisis must receive the urgency that is its due. In New York, the data shows that Black and Latino New Yorkers are disproportionately likely to fall victim to coronavirus, to feel the effects of economic downturn and unemployment, and be targeted by law enforcement. And let me also add that women of color are disproportionately affected by this coronavirus, because most of them are essential workers. And these disparities spark calls for reform, and there is no more important time for conversations about change and accountability than now, and they need to happen in the library. And so I really want to thank Dennis for having this conversation. As a head of the law enforcement agency in New York, I strive every day to see that justice applies equally under the law, no matter a person's race or zip code or their gender or zip code or their sexual orientation. And so we have been on the front lines. As most of you know, the governor of the state of New York asked me with the responsibility of investigating the interactions between NYPD and the police. We hosted days of public hearing, 3 days in fact, and the testimony between the protesters and the police commissioner, who I'm grateful that he came to testify, was a stark contrast. And the comments from the mayor and the police commissioner were stark contrast to the 100 protesters who came to testify. And we issued a preliminary report last month providing recommendations for systematic police reforms. A final report will come out soon, but we've called for concrete changes, such as the creation of an independent panel to oversee the police and hire the commissioner. It was a first step towards ensuring that our institutions serve all communities fairly. It was an attempt to democratize the NYPD, because the police quite simply cannot police themselves. But our work is far from over. The actions my office has taken in response to coronavirus and the protests are only a small part of the long overdue systematic national conversation about systematic racism and institutional racism in America. We know that our laws, the color of law, I remember that reading that book by former Justice Higginbotham, which stuck with me, which was one of the reasons why I decided to go to law school. We know that all of the laws in this nation have been impacted by race and racism, but we are at a turning point in our journey, and we need to, again, turn away from hate and division, and we need to come closer towards equality and justice, and respecting the human rights of all individuals. And so I will defend the young people who march every day, who march past my door, who march to Barclays. I will defend their right to peacefully protest, and I will continue to fight for the rights of Blacks and Latinos across the state, and for all marginalized and vulnerable populations. I'd also like to leave every New Yorker joining us today with a two-part call to action. First, to participate in the census and to make sure your colleagues and friends and neighbors do the same. A complete and accurate count, obviously, is going to impact reapportionment and making sure that we've got a fair share of funding coming from Washington. And second, this is an election year, and we have an opportunity and an obligation to vote. We got to do it for John Lewis. We have to do it for all of those who braved the way, for all of us to be in this position, for all of those who struggled, for all of those who don't have opportunity, for all of those who sacrificed and bled and died for us to be here. We must not miss that chance. No matter what they throw at us, we've got to vote. And so now is the time, especially because democracy is on the ballot, decency is on the ballot, our rights are on the ballot. And I really want to thank you for having me here tonight, and I look forward to the discussion.
Thank you, Madam AG. And before I get to Dr. Riley, I just wanted to ask you one follow-up question to what you just. Was there one thing, either growing up, aside from the book that you just talked about, were there things or one thing that happened to you in your formative years around race or racism that really started to drive and motivate you to be who you are?
As a young child, I remember growing up in Brooklyn. My brother was arrested for stealing a bike, and I remember my mom grabbing me and saying we have to go to court. And I didn't understand the concept of that, but I went anyway. And when I walked into the courtroom, everyone in the courtroom, particularly the defendants, all the defendants looked like me, and everybody else in a position of power did not. And I remember my mom simply asking a question: where was her son? Why was her son arrested? Why was he falsely accused? I remember the officer telling my mom to shut up and sit down. And I vowed never, ever again to allow that to happen to any other mother or grandmother or father or grandfather for simply asking the question, where's my loved one?
How old were you? How old were you?
I had to be around 11 or 12 because at that time, the only thing that I was concerned with was Jerome and Tyrone. And ever since then, they're in the rearview mirror.
Okay. Dr. Riley, so the Attorney General mentioned several times in different ways the issue of COVID and the disparate impact it's had on communities of color, especially the decimation and sad losses that we've suffered in the Black community. Can you take us a step back? Because you were sharing a story, I think, before we went on air about being in the barbershop and how conversations were taking place, and this is before it really started to hit in March, and then take us from there as far as your role in this whole fight and what you've been doing in a very admirable way.
Thank you, Dennis. Thank you so much. Thank you and your team at the Queens Library. And let me salute the outstanding Attorney General of the great state of New York, a distinguished public servant who's admired and loved by all, one of Brooklyn's greatest. AG, honored to be with you tonight and in this dialogue, very important dialogue on issues of racism with regard to criminal justice, and also to discuss healthcare. But I'll start going back to end of January. I recall very distinctly, Dennis, that I'm a subscriber to a number of news feeds, right? So I get Wall Street Journal, New York Times, Washington Post, Amsterdam News, and I also get medical journal alerts. And I remember I was sitting in a meeting in Atlanta, Georgia, the end of January, and my iPhone is just getting pinged, ping about what's going on in China, right? And all the data that was beginning to emerge out of China was that coronavirus was particularly hard on Chinese citizens with, guess what, pre-existing conditions, hypertension, diabetes, heart cancer, etc. And I'm thinking to myself, oh my God, if this thing hits Brooklyn, it's going to be bad. So when I got home 2 days later, I'm sitting in the barbershop, and the barbershops and beauty salons, as we all know, is a very important part of Black life. It's psychotherapy, it's picking up the rumors, picking up information, etc. And sometimes you pick up wrong information in beauty salons and barbershops. And I will say particularly barbershops. As you know, I have 3 sisters, and they tell me things go on in beauty salons too, Attorney General. But my experience has been in barbershops. My barber's sort of, doing my hair, and these 2 guys are off the corner.
See, you still have hair. I don't go to barbershops as often anymore. So I'll let you talk about barbershops.
Yeah. So mine is great. Still have some. So I'm listening to this conversation, and these 2 brothers who were about 35 years of age, they were in mid-30s. They weren't too young, weren't old, but they started to have this conversation. Oh no, we can't get that. That's just for the Chinese people. And I almost jumped out of the chair, and like I said, I almost left with a mohawk, a one-sided mohawk, thank God my barber adjusted, the clippers, because I said, gentlemen, that is not true. And I identified myself. I said, look, I'm a doctor and I'm a Black doctor. And I'm telling you right now, if this stuff hits us in the United States, in New York City and in Brooklyn, it is going to be bad. And unfortunately, Attorney General, it has been bad because of the high level of pre-existing conditions we have in central Brooklyn and in all of our families. I come from a long line of diabetics in my family, both sides, right? I come from a long line of people who have had these chronic diseases that I knew were going to be a setup for Brooklyn, for the Black folks of central Brooklyn and the Latinos of Queens and the Bronx to be devastated by this. And then unfortunately, I was correct. And so if we frame the discussion around racism in healthcare, it's the disproportionate impact that our communities have suffered through the years. Pre-existing conditions did not materialize in January of 2020. We have been fighting, pre-existing conditions, quote unquote, for 400 plus years in the United States. From the moment our enslaved ancestors hit the shores of the United States of America, we have never had the health status of our fellow white citizens. Think about that. From the moment our ancestors set foot on the soil over in Virginia, we have never had the same level of health and wellness that our white friends and neighbors have. And so if you think about how far we have to go in terms of health and wellness, and then you throw in the systemic racism that the Attorney General just articulated. Systemic racism not only affects us in terms of the criminal justice system, but I'm here to tell you it affects the way we live, life and death as Black Americans. So racism, we now know, plays a role in a number of health conditions: hypertension, low birth weight babies, our self-reports of how we feel about ourselves and how we feel on a daily basis. It affects the number of days of sick leave that we take if we're employed and if our employers give us sick leave. We have high rates of respiratory illness because of racism. And then you compound the anxiety, the depression that then overlays all of the physical ailments we have. Then you get into the realm of the behavioral and mental health aspects of racism. The microaggressions, the macroaggressions we've all had to deal with in our schooling, in our workplace, in our interactions, sometimes even going to a restaurant, or going to a store, being followed around a store. Madam Attorney General, I got stopped, sort of the same age as your nephew that you spoke about. And I've been stopped about 8 times in my life, as we say, driving while Black, right? So when you put the stress of all that, and then you add the extra dimension of the fact that there's implicit bias in some realms within the healthcare system, that Black patients, when they present to doctors, their symptoms are minimized, or they don't get the right medication, or they're not recommended for the right procedure, or they're just not counseled appropriately. That compounds it. So you can now see, Derek, that we have this toxic stew of racism that does have a disproportionate negative impact on the life of every Black American in this country, and I would argue even Latino Americans as well. So, and even if you slide into the issues of criminal justice, where the Attorney General is leading her efforts, gun violence is a public health problem. One of the most searing memories I've had in my professional life is when I was president of the American College of Physicians about 5 years ago, which is the largest organization of internal medicine doctors in the United States of America. I had the opportunity to go to the Mother Emanuel AME Church in Charleston, South Carolina. And I had to speak on gun violence as a public health, and that we were advocating for stronger gun control measures, Attorney General. And I said, can you take me down to where Reverend Pinckney was conducting the Bible study, and with that young man, Dylan Roof, who they took me down there. And I never forget, it's just like any other church basement you and I have been in, Attorney General, where there's men's day programs and women's day programs, and they do the potluck suppers. And they took me down in the basement of Mother Emanuel Church. And the deacon who was giving me a tour, he said, look at the floor. And I looked down to the floor. There were bullet marks still in the floor from when Dylan Roof murdered the Charleston Nine. And my heart just sank. And then the pastor's door was right there where his wife and his daughter were waiting for him. And they heard this whole thing. So again, you know, the experiences that both the Attorney General and I have had in our professional lives that if you will, vitiate our work, our passion for healthcare and criminal justice are important for all of your listeners to embrace at this critical time in the nation when we're dealing with systemic racism, police misconduct, unfortunately, the black on black crime is now another issue that I know the Attorney General may want to talk about that as well. We've got to pull together as a community and work on our issues in terms of health and wellness. I'll turn it back to you and the Attorney.
No, before we get back to the Attorney General, can you share with us something personal with you and growing up that may have impacted your frame of life and your destiny as far as where you were going? Because I mean, you have, like the Attorney General, an esteemed background and career. And again, being Deputy Mayor of 26, I mean, what impacted you and what racial or racist thing happened to you to drive you to where you are right now?
Well, as you mentioned, I'm a Southerner. I grew up in the great city of New Orleans, but New Orleans was a tough place for African Americans. You know, even to this day, it's still tough. My sister still live there. It's a tough place to live. It's beloved. It's a fabled city. But I come from very humble backgrounds. My paternal side, neither one of my grandparents went to high school. I think my grandfather had a third grade education. My grandmother, not much more than that. They were domestics and truck drivers, and then they had one son. And then if you think about my paternal grandparents not going to high school, and then in a generation, their grandson goes to Yale and, you know, had the opportunity to lead Meharry and work for a mayor of New Orleans, and now leading one of the storied academic health science centers in the greatest city in the world and the greatest borough of the world. That was not within their realm of reference. So I never forget my humble roots. Like many Black families, we've had interactions with the criminal justice system. I lost my first male cousin, unfortunately, fell victim to gun violence as a result of drug dealing. My uncle died of a drug overdose. The end of my sophomore year, I'll never forget. My father picks me up at the airport. He said, "We're going to the hospital." I said, "Why?" He said, "Your uncle's in the ICU. He's not going to make it." And he had struggled with drug addiction most of his adult life. So, you know, the experiences that both the Attorney General and I've had, even though in different cities, different parts of the country, are formative to why we feel so strongly about healthcare as a human right and criminal justice as a right for all Americans to be treated fairly under law. And again, these are two critical issues of our time that have to be addressed both within healthcare circles and in legal and justice circles as well.
So you both have been really segueing each other's points, because when you talk about the issue of guns and gun violence, Attorney General back, was it last week? You announced the lawsuit or litigation against the NRA. Would you take some time just to talk about that and what that actually means?
Sure. I think it's important that individuals know I want to dispel a certain narrative. This litigation against the NRA has nothing to do with the Second Amendment, has nothing to do with gun rights, and has nothing to do with my personal views in regards to gun violence. It has to do with the diversion of millions and millions of dollars to basically fuel the lavish lifestyle of four individuals and the corporation, which had an obligation and a fiduciary duty. They unfortunately failed in every regard. There's a responsibility and a duty of officers, executives, corporate boards to adhere to and to comply with not-for-profit law. And unfortunately, for a very long time, the NRA, which is a very powerful but an unchecked corporation, unfortunately was flouting the law. And to the point where the NRA right now has pretty much depleted its assets. And so on behalf of donors, and in order to enforce the law as the chief law enforcement officer of the state of New York, I had a responsibility and a duty to follow some allegations, which I didn't make up. They were on the front page of every newspaper outlet in this nation. We had a duty to investigate, and when we investigated over 19 months, we made some conclusions of law and some recommendations. And because the rot runs deep, we are seeking that the corporation be dissolved, restitution, that these 4 officers be barred from serving on any not-for-profit in the state of New York. And we're seeking an accounting. And that's what this lawsuit is all about. Now, I also last week marched with women in Brooklyn, women of color. There's a lot of them who've lost their children as a result of gun violence. But I also marched in honor of a 1-year-old baby who was shot and killed at a barbecue. And so we were sisters who just marched from Borough Hall to Restoration Plaza last week to raise our voices and to increase the peace on the streets of New York City, and particularly in Brooklyn, and also to demand change, because guns are not manufactured in New York City. There's no gun manufacturer in New York City. And yet gun sales are off the hook. There's been an exponential increase in gun sales in the nation during this COVID period. And I believe that there's a correlation between gun sales and the amount of violence that we're seeing. It's because these states, particularly the southern states, have these lax gun laws. And so we need reform, and we need to basically stop the violence. And if we're serious about this motto of this anthem of Black Lives Matter, the lives of babies, innocent 1-year-old babies, should matter as well.
Totally agree with you, man. And thank you for the update. I mean, one of the things I think people don't know, well, I mean, not all people know, that the NRA is registered here in New York State, which caught me by surprise. And then your office has their Charities Bureau, which monitors all not-for-profit 501c3 organizations in the state of New York. So it definitely falls within the purview of the AG's office and what you regularly do with organizations that are registered, correct?
They were registered in New York in 1871.
Amazing fact. That was an amazing fact that I read. Crazy.
And they weren't registered as a gun rights organization. And they were given a grant by the state legislature. But they were, again, organized and incorporated as a not-for-profit in the state of New York, even though they are physically located in Virginia. But nonetheless, they must comply with the laws of the state of New York, not-for-profit laws in particular. And unfortunately, they failed to do that. And they basically looted the NRA to support this lavish lifestyle. And although there's been individuals on social media, trolls who've been criticizing me, there's been some individuals on the right, some donors who actually support my position. And I thank them for that, for recognizing that this has nothing to do with the Second Amendment. I do not want to take their guns away. What I want to do is have them comply with the law.
Can you take a second before I go back to Dr. Riley? Can you take a second to talk about the AG's office? I mean, you've talked about a number of things that you've already tackled or in the process of tackling. But I think the breadth and width of what the AG's office does, maybe a lot of people don't have a sense of it, and how race is playing a role in how you're shaping it moving into the future.
So I'm the chief law enforcement officer in the state of New York. My first mission is to defend state agencies. I represent the governor of the state of New York and all state agencies, as well as the state legislature. And so it's our responsibility to engage in, to do defensive work. The vast majority of our work is defending the laws, defending actions by the state legislature. Right now, we have been very busy defending executive orders that have been issued by the governor. We've been working with the governor to craft executive orders. And so gyms have sued the state of New York. Funeral parlors have sued the state of New York. The wedding industry has sued the state of New York. Even gentlemen clubs have sued the state of New York, all again in challenging these executive orders. Landlords have sued the governor as well as my office, again, in regards to these executive orders, because there's this moratorium on rent. So we've got the defensive work. We also engage in, I started the Federal Initiatives Bureau, one to respond to the retrenchment of federal government. And so this administration, the Trump administration, as you know, has been hostile to immigrants, and we fought back. We've defended the census when the president, this administration wanted to put a citizenship question on the census, which would have had a chilling effect on the response rate. As you know, most recently, and we were successful in that. But then the president decided to change the date to lessen the amount of time to collect the data, and because he wants to exclude the information from immigrants in reapportionment. We're suing him. We're in court on that. On Trusted Traveler, he wanted to ban us, New York's participation in the Trusted Traveler program, so that New Yorkers can go through the airports more rapidly. We won on that case as well. On public charge, he wanted to deny immigrants resources like food stamps and Medicaid. We won that lawsuit as well, thanks to Judge Daniels, another Howard Law grad. We won on environmental cases. In fact, filed more environmental cases against this administration than any other attorney general in the nation. We won on most of our cases, on illegal dumping, on reducing energy fuel standards. We've been winning across the board with regards to any challenges, and unfortunately, this administration has sought to dilute the Clean Air Act, the Clean Water Act, you name it. We've won on reproductive rights. We've filed amicus briefs in southern states where during this COVID period, where they want to treat reproductive rights and abortion in particular as a non-essential business. We joined with Planned Parenthood and other respective organizations to challenge those states, and we've been winning across the board. So we've been doing federal initiatives that keeps us busy, and then we do affirmative litigation where we sue landlords, where we have all of these different bureaus. We've got the Healthcare Bureau. We've got Medicaid Fraud Unit. We investigate cases of neglect and abuse in nursing homes. The governor has tasked us with issuing a report on unfortunately, how COVID has ravaged our nursing homes. We'll be issuing that report. We have a criminal justice and a civil rights bureau, a hate crimes unit bureau. We've got an antitrust bureau. We've got a real estate and fraud, a tenant association bureau. And one particular bureau that we have is a bureau where we investigate, unfortunately, whenever there's a death during a police interaction, we have to investigate those cases when the individual is unarmed. And that can be somewhat controversial. And primarily it's because of the laws that we have in the state of New York are somewhat limiting. The office has been criticized for that. And we're hoping and looking to get some changes in the state legislature so that we can, again, hold individuals accountable.
Thanks. I mean, for me, that was very informative. I mean, just the breadth of what you do and what the office does is just truly amazing. And I imagine there's a lot of cross partnerships also with other AGs as far as national issues and how that impacts society.
We have elected, when I was elected, we elected 4 other African-American attorney generals. So we now have a caucus. There's 5 of us from DC, from Illinois, from Nevada, and from Minnesota. Keith Ellison, who is investigating that case, he's a very good friend. Aaron Ford in Nevada, Carl Racine in DC, and of course Kwame Raoul in Illinois. We have formed a caucus, and we meet not only all Democratic attorney generals, we meet weekly, and all AGs. We have a National Association of Attorney Generals. We meet regularly. And right now what we are doing, and I'm part of it in leadership, we are negotiating an opioid settlement, a national settlement to deal with the opioid crisis in our nation. And hopefully we will get an agreement very, very shortly.
Wow, great to hear. Doctor, so you've been there a little while at the hospital, and you've come in again with an excellent background that has been great during, unfortunately, this pandemic. Talk about the evolution of the hospital and what you've been able to do and how race has impacted some of your decision making around and how the hospital treats and works with the community.
Well, again, this is an interesting setting for a hospital. A little history here. This hospital was built during the Rockefeller administration. And when I say this hospital, University Hospital Brooklyn, which is our teaching hospital, safety net hospital, serving central Brooklyn, predominantly Black Caribbean patient clientele, was built between 1960 and 1963 by Nelson Rockefeller for $25 million. It is truly a safety net and a large employer in Brooklyn. But one of the challenges we did have during COVID was that our hospital is a little long in a tooth. And again, one of the things I've been very transparent about is, I want the best care for patients, my patients of Central Brooklyn, as if they could get in New Haven or Upper West Side of Manhattan, Upper East Side. And so I've been a strong advocate for greater investment in our hospital for what we do, not only to serve the community, but this is a great asset for the great state of New York. I think it's estimated that every 2 out of 10 physician in the entire state of New York has either graduated from Downstate or trained at Downstate as a resident trainee. 60% of our doctors that walked across the stage virtually, by the way, last May, remained in New York State. And again, that is the value proposition I continuously try to articulate to members of the New York Assembly and our governor, our state leadership. This is a tremendous asset that deserves increased support because of its impact, its major impact to New York City, Brooklyn, and New York State, and indeed the world. Downstate graduates are everywhere. I was in California giving a speech, and 5 downstate graduates came up to welcome me to California. No matter where I go, Attorney General in the great country, there is a downstate graduate. We're a major contributor in nurses, physician's assistant, physical therapists, healthcare administrators. So I think one of our biggest achievements, and this was very strategic on my part when I got here, we changed our name to Downstate Health Sciences University. Because and I told the trustees, I promised them if they changed the name, I would not recruit a football coach and all that other stuff that other universities do. We're not going to have a big band like the HU band, Attorney General, but we're going to dance to our own tune and create our own excitement by training a whole bunch of healthcare professionals and taking care of the patients of Brooklyn like they could get care in Upper East Side of New York. So I'm passionate about patient care. I've been trained to be a stickler. I never set out to be president of anything. I just wanted to be a good doctor. And I got labeled as a good doctor. Next thing you know, they asked me to run this, run that, and so forth. So again, I am passionate about patient care. And this is the other aspect of racism in healthcare. Look, I am very concerned, and I just had a long conversation before coming on, that in this COVID era, I am hearing anti-vaccine sentiment among some African Americans. Well, ladies and gentlemen, let me tell you bluntly, we cannot take the okie doke from these anti-vaccinator crowd, because you know who will be damaged the most? It won't be them, it will be Black and brown community. So what I'm saying, Dennis, is the moment we get a truly FDA approved vaccine that has the data supports its use, I will be the first person in my institution to get that shot, because I want to be an example to the Black community of Central Brooklyn. Get your shot. We cannot, and I almost jumped out of the window the other day. I heard 2 NBA basketball players articulate the inane thought that, I don't believe in vaccines. And I called a friend who's an executive at the NBA Players Association. I said, do you have some doctors talking to your players? Because what they're saying is dangerous. We're going to need everybody in Central Brooklyn getting a anti-COVID vaccination when it becomes available. And I am going to be downright evangelistic, irritating about it, because I want our community protected. And we cannot let our Black folks and the brown folks in Queens and the Bronx get dissuaded from getting this vaccine, because I know, based on what we're going through today, that we will bear the brunt of the continuation of this virus if we don't get access to that vaccine. So I've argued for stronger testing in Central Brooklyn. We need to have testing as ubiquitous as Starbucks. I've said that. I've said it on national TV that we're not doing enough testing in this country. And I've gotten angry emails from people saying that, you know, I don't know what I was talking about. But we need to invigorate our testing, particularly in hard-hit areas like Central Brooklyn, Queens, and the Bronx.
Madam AG, looked like you were about to say something, even though I don't. Okay, I wasn't sure. I saw the body language change around the vaccine, because, I mean, what you are raising, doctor, is another issue that will have a major disparate impact on communities of color and the Black community.
Yeah.
If we don't go through this whole process. And I think, you know, what you're talking about also, and this goes back to the AG and her role as just an advocate in general, is advocacy even before the vaccine becomes official, because people don't need to have their mind polluted in thinking that vaccine doesn't work at all or won't work, or
No.
me as a Black person. And that's the last thing we can afford to have happen.
And I think it's important, we had to push elected officials of color in this city and in the state for access to rapid testing, for tracing, for additional resources for our safety net hospitals. And so when a vaccine is finally manufactured, we're going to have to push, and not only just push, but we're going to have to serve as examples and stand up to these anti-vaxxers, or whatever they're called, because we've got to save our community, and it's really all about access.
Right.
Totally agree. And then one of the things you don't know, or you might not know, is that in Queens, we converted one of our libraries into a test site. So we gave it over to health and hospitals. And so as of last week, I think we had 4,000 people who have come through this particular library for testing. And I was one of the first to go for my test there. And now at another one of our libraries, we have a mobile test site taking place where they set up on Monday and will be there until Friday. And then I have another idea that I'm going to share with H&H on another potential site located in the community where to set up a site to do testing. And again, the role we can play as a library in informing, because I mean, we're not an advocacy organization, we're an educational organization. We're a democratic institution. Yes, ma'am.
And it's free, because, we've been dealing with a lot of fraud. People are going door to door saying that these tests cost a fee. They're free. So please don't pay a fee for a test when you can get it free at your library. And
so thank you for that. And you raised a point, Doctor, and Attorney General talked about this as well, around the rapid test. So on average now, I checked with the folks at H&H Monday when they were setting up the tent in front of the library, that it's still taking 5 to 7 days. At what point does that become useless and have, again, a racial impact as far as people going? But then the reality is that it's not doing me any good, because by the time I get my results, who the heck knows who I've touched, been in contact with, and impacted? So how do you balance that out, Doctor?
Well, you're right. And this is, again, a source of frustration that many of us have, that the testing is taking too long because it's not widely available. Now, you got to separate the testing to what we call ambulatory testing, meaning you walk into a center getting tests. That's taking 5 to 7 days. Unacceptable, as you say, because even if you feel well, the nature of this virus, particularly in young people, and I'm worried about young Black and brown kids, who may not have any symptom at all, but they're shedding virus like crazy. And then they go home to their multi-generational households, many of which we have in our community, as you know, in Black and brown communities. And of course, their seniors, their parents, maybe their siblings have these pre-existing conditions we first talked about. And that's a perfect setup for this. So that's why, again, if we could get the test back within a day, 24 hours would be ideal. We could tell that person, do not go home. Do not go home, or if you have to go home and you can't go anywhere, do not go into the part of the house where your seniors are, where your grandmother, your grandfather, your parents, you self-isolate. See, that's the reason why we need quicker testing results. Because 7 days, think about all the people you come in contact with on a 7-day basis. From the morning you wake up, when you go to get your coffee, or I know you like to work out first when the Y was open. It's not open yet, but you think about it. You go to the gym, you go get your coffee, then you go to work, then you go, if it's Wednesday, you go to church, you go to Bible study, or you go here, you go play golf, whatever. You go down, you go shopping. You infect 1,000 people theoretically by not knowing if you are symptomatic and positive. So again, the frustration I have is, Madam Attorney General, I ordered a $500,000 piece of equipment to do 1,000 tests a day in March. I do not have that equipment today. And again, the suspicion that we have is that the manufacturer is playing favorites with other parts of the country, and for what reasons. So again, I have argued, give me that equipment, because I want to test Central Brooklyn and protect the patients of Central Brooklyn with a expanded testing capacity that will help stem the virus, but in fact will save lives.
And that's why we need leadership at the top. It goes back to, again, how we opened up this discussion, having a president who understands that we should have nationalized this response to COVID-19, as opposed to institution competing against institution, or state competing against state, or municipality against municipality, and people just engaging in price gouging.
Right.
Without question. And then I got to ask you this, Doctor, then. If it's a choice between waiting 5 to 7 days for a result that is probably more accurate than a quick turnaround test that gives you a result that may not be as accurate, how do you balance that? I mean, the impact, as you said, on household and what it means.
Yeah.
Where's the line of acceptance as one versus the other?
Yeah, Dennis, that's a great question. Our thinking is different in August than it was in March. We were very concerned about what we call tests that aren't all that accurate in March. But look, we will take a test that's 80% correct. We'll take a 20% incorrect rate, because we know we're protecting the 80%. You see, you follow my logic here? So the issue is, some of the tests have a 20% false positive rate, right? So, false negative. So if you have 20% false negative, at least you can clear up the other 80%. And so our thinking has shifted. Now, that kind of test is the more rapid test that's not as accurate as the quote unquote PCR test, which is the gold standard. That's the one that if you get a positive PCR test, you got 99.9% that you are positive or negative in whichever case it may be. So even, I hate to say it this way, but even mediocre testing can be helpful in certain situations while we work to get the testing better perfected going forward.
Madam AG, wasn't sure if you're about to say something. No. So as we draw to a close, one of the things this part of the conversation has really, I think, enlightened us about is the impact of both testing, the results of testing, and the importance of educating the community around vaccines, and the importance of vaccines for those who want to advocate something totally different. And I think through partnerships between your respective offices, through your libraries in Brooklyn, even though we're here in Queens right now, it gives people necessary information that they should have. Because I think for all of us, we need to be educated. We need to hear what's going on, because there's so much false news out there. And we at the library have a responsibility to make sure we provide that, and we're doing it virtually and also As you may know, in Brooklyn and the New York Public Library System and the Queens Public Library System, we're gradually reopening our libraries for grab-and-go services right now. And so people can order information. So the more information that we have, we'll be glad to put it out there in the public life discourse as well. So just wanted to share that with you.
What you're doing, that's leadership. That's leadership, Dennis, in terms of what a library can do. We're dealing with health literacy issues. You deal with literacy and information as empowering for communities. Well, I think this is perfectly consistent with the need for health literacy to combat the silliness that I heard from two NBA players who are anti-vaccine when this disease is ravaging our community. So no, thank you for your leadership. Health literacy is a perfect for a library, whether in Queens or Brooklyn or Bronx or Cincinnati or New Haven or Washington D.C. to play to get the information to Americans.
Staten Island, Manhattan as well. I got to share an inside baseball story with you real quickly. If you notice, the lights changed a little on my side of the camera.
You got
medically sealed office that I talked to you about, and so the custodians didn't even know I'm back here. So they shut off all the lights and said, "Okay, nobody's here." So then we click. So as we close, I got to do two things. One, ask you both, just some summary statements. But before I ask that, you got to know in my former life, I used to head the New York Urban League. And one of the things that we did at the New York Urban League was host the football classic at the Meadowlands, where we had HBCUs playing on a regular basis. So when you talked about the bands, you made me take a step back in my memory lane. And one of the greatest things, and also the tie into Brooklyn, because one of the things we did, we recruited the Jackie Robinson Steppers. This is before your time, Doctor, the Attorney General. The Jackie Robinson Steppers, who were a youth marching band there, and they turned it out. They beat the HUs, both HUs that played there, as well as the other historically Black colleges and universities. So that was a great synergy of HBCUs coming together for a good time, a serious time, raising scholarship money. So Madam AG, let me just turn to you for closing statements, which you do so well.
So I just want to thank you, because I can recall way back when calling you and begging for tickets. So I remember, telling a couple
did I give them to you or not?
No.
That's good.
And then I lied and said I was part of the band, and you didn't fall for that either. Listen, I just want to thank you for your leadership. I want to thank the good doctor. And just tell your audience, really, right now, it's all about the census, filling out the census. Everyone matters, and therefore everyone should be counted. And also registering to vote. That's what's really critically important. As you know, right now, we're facing challenges with regards to our United States Postal Service. And my office is looking into that as well. And hopefully we can continue our research and announce something. But we have a national group that is looking at the issue. Again, democracy is on the ballot. The rule of law is on the ballot. And we just need to vote. Whatever they throw at us, just remember John Lewis, and just get in some good trouble. Thank you.
Madam AG, thank you for you being you. We really appreciate your leadership, your advocacy, your passion, your commitment to the community, and just doing an outstanding job up there. We say thank you to you. Dr. Riley, would you like to have some closing words as well?
Yeah, just quickly, thank you, Dennis, for your leadership in New York City. You are a legendary public servant and advocate for all things that are good and necessary to make our city and our country more just and gentle. So thank you for your leadership over these many years and your great work at Queens Library. And to our terrific Attorney General. Boy, are we blessed in New York to have the Honorable Tish James as our Attorney General. And good luck to you, Madam Attorney General. And, my final word in terms of, all the things that we've talked about tonight is, we're at a moment in this country where we have to stand up. And as the Attorney General said, I think about Congressman Lewis, a great man. Had the opportunity to get to know him when he came in and out of Nashville when I was there. And, you know, this is a time where we need to get in good trouble, whether it's related to healthcare or criminal justice or community improvement, being active and not resting. You know, the great Jesse Jackson used to say, I want to leave this world, you know, worn out, not rust out. And, you know, that's, I think, the approach you're seeing from the Attorney General and I, that, you know, keep plugging, keep doing the great things, keep raising the issues, keep advocating, keep fighting the NRA, keep fighting, you know, to protect Black one-year-old kids who should not meet their demise through senseless gun violence. Those are the things that we feel passionately about for the betterment of our wonderful community. So thank you for the wonderful honor for participating.
And thanks to both of you, and have a great remainder of the summer and keep it up.
Thank you so
Appreciate
much.
it. Thank you both.
Thank you.
And thank you to the audience as well for being there, and hopefully you enjoyed our conversation on race and racism in our society. Thank you very much for joining us.
Thank you.